Good afternoon, colleagues, and many thanks for coming to this event. It used to be once in 18 months. I hope this continues. So, I'm talking to you today about this important topic on how UNICEF is supporting in building environmentally sustainable health facilities, reducing the carbon footprint of immunization program in low and middle income countries. So let's quickly look at the problem definition, what the problem is, what the problem we are tackling today. We'll now have a high level overview of challenges and the issues we are confronted with and our solutions approach towards the same. What you see on the screen is the foundation of our intervention, the detailed guidance from WHO on building climate resilient and environmentally sustainable health facilities. As you can see here, we are challenged with climate change and its impact. By building climate resilient health facilities within the programmatic framework of health in the healthy environment for healthy children, we bring in positive environmental impact, which in turn reduces our carbon footprint and reduces the climate change impact. At the center of intervention, we have actions on health workers, wash, access to energy, and infrastructure technologies. This is all linked to AI agenda. You saw in Olamide's presentation about access to PHC infrastructure because of our reach out and strengthenings. Furthermore, deep dive into operational framework of primary healthcare and how we are strengthening the PHC services and infrastructure, adding up to achieve sustainable development goals, specifically SDG 3 on universal health coverage. Stepping up the challenge on access to energy, close to 1 billion people in low and middle income countries do not have access to reliable electricity. This is the reminder again that access to energy is one of the lever of building resilient health facilities and for impact on SDGs. I'll bring up now this important study which UNICEF conducted recently. Of course, this is uh, carbon emissions estimation, and it's an estimation. It's one of the most difficult estimation to make. We have looked into the entire supply chain of immunization program, right from production to transportation to cold chain maintenance, production of vaccines, production of cold chain equipment, cold rooms, everything which is involved in this immunization program. We looked at it, and we looked at the operations of the supply chain equipment using the grid energy, using the diesel energy. We looked at the waste management, how we dispose of our waste, and came up with this broad estimation that we are today producing 350,000 carbon emission equivalent tons of equivalent CO2. What is the How does it equate to? It's equivalent to something like 230,000 passenger flying on New York Dubai sector on economy flight. This is the emissions we are producing today to deliver our immunization program. Of course, I'd like to make a caveat that the manufacturing of vaccine is very controversial. It's we are getting different data, so it's still under discussion and it's ongoing exercise. We are updating the numbers uh, on this, but just to deep dive a little bit, these are the big players. Production is about 20%, and transportation is 27%. Now, the transportation includes both transportation of vaccine by air and and supplies of syringes by shipment and cold chain equipment by sea shipments. And you see that the big elephant in this picture is really operations, waste management, and transportation. Production is something which is already regulated by and large. There are efforts globally to manage the production and reduce the carbon emissions, but these are the three which is where we have a massive scope of improvement. Another part of the problem definition I'll bring up to you this picture. This is the waste generated at the hospital, and uh, we in immunization let's say community always look at the waste from the point of view of the immunization waste. Of course, immunization waste is our responsibility, but the whole point is we cannot solve the problem of waste by addressing only immunization waste. We have to look at the bigger picture here. So with this very broad problem definition of what we are dealing from the climate and lens is now let us look at what are our strategies and plans to address these problems. As you saw, um, maybe I pressed the wrong one. Yeah. So you saw this earlier. My colleague Olamide presented this one, this slide. It's these are the low-hanging fruits which we should be hanging on to, and while production is about 20% of the total share, we should be looking at how do we address the how do we address the carbon emissions. So by solarizing health facilities, we get about 25% of the carbon emission savings in the program. Transportation, look at either local production, localize the production and reduce the air shipments of the vaccine, or look at shipments through sea. Will reduce the emissions by further by 20%. And disposal, if we manage our disposal, we disinfect the waste and recycle the plastic, and convert our waste into somehow recyclable means, we still cover 25% of the carbon emissions. So what do we mean by solarization of health facilities? Let's deep dive into that and what is covered in this part. We did a very quick survey. We know that World Bank has been doing, and there are lots. There's no dearth of data. So we did our internal survey within UNICEF community, UNICEF offices across globally, and in turn we spoke to Ministry of Health, and we have our data on cold chain inventories, and we deep dive into that and say, look, what is our demand? How does it look like? So the numbers are similar to what we hear from the World Bank report. About 100,000 health facilities are in need of electrification today. There's no electricity there, which also correlate with the supply of solar direct dry fridges. We are solving solar problem, the problem of fridge with the solar fridge, but solar fridge is not solving other primary healthcare problems. So we did our demand, and it looks like of this 100,000, 30,000 facilities are really low-hanging health facilities. We provide solarization there. The impact is incredible. So what are we solarizing? When we say solarization of health facilities, we look at these elements. We look at the electricity. We look at a fridge, which not only provide the storage for vaccine, but primary healthcare commodities, oxytocin, insulin, anti-snake venom, anti-rabies, other essential medical drugs, essential list of the drugs which requires the refrigeration, water pump for water, uh, digging out water from this thing, and then neonatal care, laboratory equipment. All this is part and parcel of the package which we do. So how we do this? First of all, we also, when a country approaches and say, look, we want to do the solarization, we say the first thing you need is a technical assistance framework, somebody who can run the show. And that technical assistance package includes services like assessment of the facilities, assessment of the national policies, ministry coordination with Ministry of Health, Ministry of Energy, Ministry of Finance, and come up with a list of equipment that requires to be there in the health facility, and then based on those assessments, draw the packages from there. And then we are also looking at procurement and deployment of these systems. So we have supply division which does this job. We have supply division has established the long-term agreements with, if I'm not wrong, 8 different suppliers today as we stand. So these are global suppliers and market competitive at competitive prices. These suppliers are, let's say, global integrators, system integrators. They procure, they ship, they install the system, and they also provide operation and maintenance for first 2 or 5 years. We can extend the contract, and this is the base foundation of our support. We're not just providing the equipment, we're also commissioning them, we are also training people, we are also establishing the system in the countries uh, where a mechanism of long-term operation and maintenance is in place. And this we are doing in together. Also, we saw earlier with Gavi, of course, Gavi support. We are trying to build in a portfolio within Gavi where countries can, instead of opting for a solar fridge, can opt for a electric fridge, for example, which is a lot cheaper, and use the funds to improve the electricity at the facility. But we are also doing in collaboration with WHO. There's a partnership with WHO where UNICEF and WHO would solarize 10,000 facilities by 2028. WHO comes up with technical assistance to the country with their knowledge of medical equipment, medical devices, medical lists, and and with the support from Selco Foundation, who are experts in this area. And UNICEF, of course, comes with the commissioning and uh, procurement and long-term operation and TA support. So how are we providing solutions to the country? These are packaged. The needs are packaged into standard sizes, and we looked at uh, typically 3 different sizes: small size for a small size facility, uh, type 2 up to 5 kilowatt, which is typical size of health facility in most part of the world, and then the larger facilities 5 to 10 kilowatts. But this is of course subject to assessments and deep dive into national policies, national plans, and what do we have in the facilities today, what are the needs in the facilities in coming days. And this is another good part of the partnership with WHO, that we are not only bringing, we're not only planning to bring the energy to the health facility, but also devices and equipment that will make the impact and bring the necessary change. So I'll quickly touch upon the aspect of healthcare waste management and its linkages with the environment. We saw that a quarter of the emissions are from the waste, which is burning the waste in open, either through incineration or whatever mechanism it is. We are releasing carbon in the air. Uh, this picture, what you see, is our success story today. We saw in health facilities that we have a safety box, we have bins which are collecting the different type of waste, and this is a very common sight. Most health facilities you find this. It starts getting ugly because the accumulation does not get does not get transported to a processing site, and the accumulation then become this, and then everything is mixed up together. This is where things get really bad, where syringes, sharps are now being exposed to people, to cattle, to animal, to children, and that is where the problem starts. That the waste from the health facility starts to create problems and starts to infect people and spread diseases. So, what are we going to do about this? There are lots of capacity building initiatives. There's no dearth of it. TechNet has a standard page on portal on its portal, TechNet 21 portal for waste management. There are SOPs from WHO, SOPs from UNICEF, all the from Gavi. There is a maturity model which is open to countries. Technical brief from Global Fund, technical brief from range of organizations. And there are also tools that helps in planning the waste uh, at the district level to support countries. We as UNICEF also supporting countries in assessments and translating that the waste problem in the country. So we are using WHO rapid assessment tool, and this is example of Botswana. I hope somebody is from here from Botswana to endorse this. So we're doing this assessment and then translate the assessment and findings into improvement plan, roadmap, whatever we like to call it, and budget it, phased plans and say what are the immediate needs, actions, what are long-term and short-term actions, and we are constantly looking for funds to support these countries. As we talk today, we are about these interventions are going on in 10 countries. My apologies, Malawi and Zambia is missing from this map. Uh, of this, Azerbaijan, Somalia, Tanzania, Malawi, Botswana has been completed. Iraq, Nigeria is in process. DPRK, we are doing that as well in the next quarter. And yeah, so that's Eswatini is as well is also in our portfolio. So what we're trying to do here is we're trying to showcase that with these assessments here we can generate a roadmap and then probably generate enough evidence, enough activities which we can replicate in other countries. Again, just very quickly to touch upon the problem of waste, that 85% of the waste is not infectious, which is produced in the health facility. But because of the segregation problem, accumulation problem, we end up with having this problem multiplied of how do we deal with, how do we get rid of that waste. My colleague is here from IAPRO. They are establishing long-term agreement with the service providers for providing the greener technologies today, which are, I hope he made it. Rizwan, you will hear from him that there is, you have a poster right on this. Yeah, so please do visit his poster and look at it. So we are looking into the greener technologies, friction, heat with shredder, autoclave with shredder, microwaves technologies as the future of waste management. What these technologies do? They not only disinfect, but they also transfer the waste into something which can be taken into a dump, which can be taken to build, for example, roads and any recyclable. What you see here is the vials being transformed into the waste on the right hand side. With this, I thank all of you listening to this important presentation. Thank you.
Thank you, Ranjit.